Okay, good morning everyone. We are going to do a scenario training and I will tell you the important information. A 26-year-old woman, 37 weeks pregnant with an uneventual pregnancy, is transported by the ambulance to the obstetric ward with vaginal blood loss. The blood loss is confirmed as the OB ward, and on the CTG they see a bradycardia of around 60 beats per minute. Under the suspicion of an 𝗙𝗶𝗴𝗵, the gynecologist wants to perform an emergency C-section. The nurse practitioner of the neonatology is called to hurry to the operating theatre for this emergency C-section, and the group has a couple of minutes to prepare for this high-risk baby. Okay, so we're going to the operating theatre. There's a term baby, suspicion of a 𝗔𝗓𝗃, a fetal bradycardia, and I'm expected the baby to be in bad shape. So I'm Evelyn, I'm the nurse practitioner, and I will do the A and B and start with the lead.
I am Marie-Claire, I'm the NICU nurse, and I will do the C and start the clock.
I'm Bridget, I'm the obstetric nurse, and I will support and take care of medication.
Yeah, and Marie-Claire, can you help me dry the baby?
Yes.
And Brigitte, can you call for O negative blood and report back to me?
Or you want it now?
Yes, that will be transferred here as well already. Okay, let's put it on. The gynecologist already starts the C-section.
Section. For intubation.
Intubation kit is ready and I call for O negative.
Perfect.
Okay.
Can you put the baby on the monitor for us? We have about 1 minute left before the baby is arriving.
Increase the temperature for the baby.
Okay, they cut the cord and someone is bringing the baby to the table. Okay, start the clock. Okay, let's dry the baby. I see a pale floppy baby. I don't feel pulsations on the umbilical cord. You want to leave the cold blanket? I'm not hearing a heart rate. Okay, this is for you, Marie-Claire, to listen.
Yes.
I start with inflation breaths in a neutral position. 21, 22, 21, 22, 23, 22, 23, 24, 25. I didn't see the excursions. We still have a pale floppy baby. Can you listen to the heart rate for me, Marie-Claire?
Yes, I will.
Subduration monitoring is on the hand. Okay, intubation is set. No heart rate? No. Okay, let's reposition. Neutral position. Inflation breath. 21, 22, 21, 22, 22, 21, 22, 24, 21, 22, 25. Let's re-evaluate. I didn't see the excursions. We have a pale and floppy baby. What's the heart rate? Can you get the suction for me? No heart rate? No heart rate. I'm gonna have a look and see if
you put the suction on for me,
yes.
please.
Okay, there's a lot of blood. Okay, there's the blood clot. I give this to you, Brigitte. And we start the inflation breaths again. 21, 21, 22.
Can you call some help for us?
21, 22, 24, 21, 22, 25. Okay, still no excursions.
Why don't we
Pale
have
and floppy baby.
I called the neonatologist Pauline, she's on her way.
Perfect.
Evelyn, I'm here for help.
Yeah, okay, perfect. This is a term baby.
Slow.
A 𝗙𝗶𝗴𝗵
Very low.
𝗙𝗶𝗴𝗵, a slow heart rate. I'm set for intubation. Can you take the lead so I can focus on A and B?
Okay. I will take the overview, you will do the A and the B, Marie-Claire will still do the C.
I will do the C.
The 𝗙𝗶𝗴𝗵 is confirmed by the gynecologist.
Okay, can you call again for the O negative blood?
Yes.
Okay, where's the tube? Where's the material? Okay, the tube is in. Okay, can you ventilate and give inflation breath, Claire?
Okay, this is in the house.
21,
Okay.
22, 23, 21, 22, 23.
Okay,
22, 24, 21, 22.
so after
5.
this we will start the evaluating and then the ventilation breath. So Evelyn, how is the A and the B?
The A and the B is secured. I saw the excursions. We have 21% of oxygen and a saturation of 4.
Marie-Claire, do we have a heart rate?
Heart rate is 23, very low.
Okay, so still bradycardia. We're going to do 30 seconds of ventilation breaths. And in the meanwhile, we're going to prepare for an umbilical cord catheter and also prepare the adrenaline, Bridget.
Yes.
After 30 seconds, if we still have a low heart rate, we're going to start resuscitation. Okay, we're 30 seconds in. We're going to do an evaluation. Evelyn, can you report back the A and the B?
The A and the B is secured. There are excursions and we have a saturation of 9 with 21% of oxygen.
Okay, Marie-Claire, how's the C? Do we have a heart rate?
The C is 32 and it's too low. I will give 100% oxygen.
And start resuscitation.
Okay. Low. 1, 2, 3, low.
Yeah.
1, 2, 3, low. 3, low. 1, 2, 3, low.
Bridget, how are you on preparing? I'm preparing on the adrenaline. Okay, we're going to push the epi after a few
2,
seconds.
3, low. 1, 2.
Do we have the...
Stuff for the umbilical line?
Yes, Bridget is preparing.
Low.
Okay,
1,
30
2,
seconds
3,
in, we're
low.
going to do an
1, 2,
evaluation.
3, low.
Evelyn, how's the A and the B?
The A and the B is secured. We have 20% of saturation with 100% of oxygen.
Marie-Claire, do we have a heart rate?
We have a heart rate of 40.
Bradycardia.
Okay, so still bradycardia. You can continue resuscitation.
Low.
And we're going to change
Yeah.
because Evelyn, you're going to put in the umbilical catheter.
Low. 1, 2, 3, low. 1, 2, 3, low.
And then Marie-Claire is going to take over the ventilation.
2, 3, low.
And Bridget is going to take over the
low. 1, 2,
cardiac
low.
compressions.
1, 2, 3, low.
So you
1,
help
2,
Edna with
3, low.
Okay.
3, low. 1, 2, 3, low. 1, 2, 3, low. 1, 2, 3, low. Low. 1, 2, 3, low. 1, 2, 3.
Okay, almost 30 seconds in, then we're going to evaluate, change, and then we need an umbilical cord catheter. Okay, 30 seconds. How are the A and the B?
A and the B are secured. We have a saturation of 20 with 100% of oxygen.
Do we have a heart rate, Marie-Claire?
We have a heart rate of 40.
Okay, continue resuscitation.
Yeah.
We're going to change.
1, 2, 3,
Bridget, can you take
low,
over the
1, 2,
compressions?
3, low. 1, 2, 3, low. 1, low. 1, 2, 3, low. 1,
We also have 2 times the adrenaline.
Yes.
I will check it.
Almost 30 seconds in, then we're going to change.
2, 3, low.
First evaluation. How are the A and the B?
A and the B are secured. We have a saturation of 20 with 100% of oxygen.
Bridget, do we have a heart rate?
1, 2, 3, 40 beats per minute.
Okay, still bradycardia. So we have an A-term baby suspected of blood loss due to placental rupture. And we're in resuscitation, going to prepare the umbilical cord catheter insertion and then prepare for adrenaline push or epi push.
1, 2, 3, low. 1, 2, 3, low. 1, 2, 3, low. 1, 2, 3, low. 1, 2, 3, low.
Do we have alcohol?
1, 2, 3,
Yes.
low. 1, 2, 3, low. 2, 3, low. 1, 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 2, 3, blow, 1, 2, 3, blow, 1, 2, 3.
Okay, 30 seconds in, we're going to do an evaluation. Marie-Claire, how are the A and the B?
A and B are stable.
Okay, Bridget, do we have heart rate?
40 beats per minute.
Okay, still bradycardia, continue resuscitation.
1, 2, 3, blow, 1, 2, 3, blow.
1, 2, 3, low. 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 1, 2, 3.
Okay, we're going to do an evaluation, and after that you can change. Marie-Claire, how are the A and the B?
The 𝗡𝗘𝗡𝗔𝗦𝗶 position, 100% oxygen, and the saturation is 22.
Bridget, do we have a heart rate?
3, heart rate 40.
Okay, still bradycardia, change positions. And then continue resuscitation.
I'm putting in the venous line.
1, 2, 3, low. 1, 2, 3.
Venous line is in.
1, 2, 3.
I'm drawing blood for evaluation.
1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2.
Okay, venous line is in.
Okay, almost 30 seconds in.
1, 2, 3, low. 1, 2, 3, low. 1, 2, 3, low.
Okay, 30 seconds in, we're going to do an evaluation. The A and the B are secure. Bridget, can you take my position?
Yep.
Marie-Claire, do we have a heart rate?
We have an heart rate of 48.
Okay, still bradycardia. Evelyn, can you push the
Yeah,
epi
I'm going to push the
with a
epi.
flush?
Low. 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 Low.
Okay, epi is in 15 minutes.
Low.
And flushed.
Low.
Okay.
Low. 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 Low.
So after this, we're going to give another epi if we still don't have a heart rate.
Low.
So get that prepared in the meanwhile.
Low.
And do we have the O negative blood in the meanwhile? Bridget told me it was ready and it also needs to be prepared. Evelyn, can you maybe take over the A and the B?
1, 2, 3.
Bridget, can you have the syringe with the O negative blood?
Yes.
Okay, 30 seconds in, so we're going to do a new evaluation. Evelyn, how are the A and the B?
A and the B are secure. The saturation is 31 with 100% oxygen.
Okay, Marie-Claire, how is the heart rate?
Heart rate is 48.
Okay, after 1 round of epi, still bradycardia, we're going to need a second epi.
And how many blood do you want per kilo?
10 milliliters per kilo.
Yeah. Epi is ready. It's lying there with the umbilical cord.
Bridget is still busy, so I will push the next epi.
I checked it. It's 40 micrograms.
Okay. So almost 30 seconds in again.
Low. Low.
Evelyn, how are the A and the B?
A and the B is secured. The saturation is 34 with 100% of oxygen.
Claire, do we have a heart rate?
48.
Okay, still bradycardia. I push the second round of
Low.
epi
Low.
with a flush.
Low. Low. Low.
Okay, about
Okay.
17 minutes.
Low.
Okay, it's
Low.
5
Low.
before 10, and we have an 8-term baby with potential blood loss due to placenta abrupturae after 2 rounds of epi and still bradycardia. So we're going to do a new evaluation. How are the A and the B?
A and the B is secured. Saturation is 41 with 100% of oxygen.
Marie-Claire, do we have a heart rate?
Yes, a heart rate of 80. I stop resuscitation.
Okay, stop resuscitation with that. Continue the ventilation breath.
I have the O negative. Do you want it by hand or by the pump?
By hand, please.
What do you want as a temperature?
This is potential asphyxia. So stop active warming. This might be a baby who needs hypothermia and cooling. So we're going to aim for a temperature around 35.
Starting the infusion now.
Okay.
Okay.
Evelyn, how are the A and the B?
A and the B are secured. We have a saturation of 68, increasing with 100% of oxygen.
Marie-Claire, do we have a heart rate?
Yes, we have an heart rate of 111.
Okay, so right now we have an 8-term baby with potential blood loss to placenta, with potential asphyxia. We were resuscitating with 2 rounds of epi, and right now recovering while we're giving O negative blood.
I'm almost halfway in.
Okay, so we should continue giving ventilation breaths and also continue giving the blood.
Okay.
Maybe someone can call the wards that we are coming, and we're going to stop the scenario here. Really, thank you for this scenario. We're going to do the debriefing now. So the first and main important things is that a lot of things really went very well, but I'd like to hear it from you. Are there things that you have to only mention 3 things that went well? Evelyn, maybe you can start because you started the scenario.
Yeah, I think what went really well is that we stayed with the A and B.
Yeah.
Because it wasn't that easy to get a good A and B. So we stayed there and didn't get tempted to go to the C.
Yeah, good one. Pauline.
Well, for me, I was later in the scenario, but there was a certain rest, and it was really clear communication for me where we were and what the problem was, or the suspected problem.
Yeah, sure. You did a very good dividing of the roles, I think. So everyone knew everyone, and everyone knew what was expected from his or her role. That was good. Yes. Marie-Claire.
I think the start of the scenario was very good. There was some rest, and everyone knows what to do.
Yeah.
And we started the clock, and yeah, I think the start was very calm and clear.
Bridget.
And for me also, I think there was a good teamwork, and we had a closed loop communication, and then for you it was obvious, so that's an extra reminder.
Yeah, I think that was a very good point. You had a very good communication. You had a good leadership. Evelyn started, but when Pauline entered the room, she took over the lead, and you told each other. And the roles were very clear, and the closed loop communication is called in the CRM or crew resource management is a very important thing. So you know that you send someone to get the blood, or you send someone to call the neonatologist and ask them to tell it back to you. So you know that your task will be done. So that was good. Do we have any points for improvement?
I think we could have called for help a little bit earlier.
Mm-hmm.
So,
I agree.
Yeah, I saw immediately that the baby was in very bad shape, so we could have called for help right then.
Yeah.
To get some extra pair of hands.
Because Pauline was there in our hospital.
Yeah.
Yeah. That's something you can do in the next time, I think. Other improvement points?
Well, I find it still a bit difficult. Obviously, you have to change and in positions and with the cardiac resuscitation. But you notice then you need extra pair of hands in giving the epi, and there needs to be a lot done in a small amount of time. So
I agree. In an ideal situation, you would have another nurse. So she or he could prepare everything. Now, Bridget was the one who had to prepare, had to do the resuscitations and try to support everyone. I agree. I think this is something that in the next time we are in this situation, you count and you think, oh God, I need blood. When we have to do CPR, you need someone extra, and you could give that call for help, of course. Other improvement points for you? I have one for you. What was your estimated weight for the baby? I never heard it.
No.
And you asked her how many epinephrine. You said the clear dose, but you never said what the estimated weight of the baby was. And it's the same for the blood.
Yeah.
You said 10 cc per kilo. Well, yeah, and you just drew 40 mLs of blood because you estimated that the baby was 4 kilos, but no one said it to each other. So this is something you could tell up front and said, okay, I think the estimated weight is 4 kilos. Give me epinephrine 0.1 ml per kilogram. So give me 0.4 ml. So it's clear for everyone what's the weight. But this is just a small point, I think. I think you overall did very well and you rescued this baby. So thank you.